Good evening, everyone. My name is Amalia Villarreal. I am a student nurse at Cedar Crest College, and the topic of my video presentation is you can might not be able to see, but the topic is how to use Tai Chi as an intervention in preventing falls for older adults. What sparked my interest in this topic was one of my previous professors in a class. She mentioned Tai Chi and how it can be used to prevent falls in the older populations. Ever since then, I've wanted to do some research, but I never really had the time. But now I finally have gotten my opportunity, and that is how this poster board became about. Um, as a student nurse, I want to protect my patients and help them stay safe and independent. Therefore, developing an intervention to prevent falls is a step towards my goal. Every year we know that older adults, 65 and older, many of them are seen in emergency departments because of falls and fall-related injuries. The long-term consequences of falls is horrible, and in some cases, or in many cases I should say, it's even death. Now, if you are able to take a look at my poster board on the statement of the problem section, we see the falls and fall-related symptoms have become a burden on the healthcare system. Every year it costs the healthcare system millions of dollars to be able to treat patients who have fallen. Falls are also a sentinel event, not only for hospitals, but also for home care agencies and long-term care agencies, because it compromises the older adult's physical and physiological health. Patients who have fallen might have less confidence in their balance, and they also be more afraid of falling since it has already happened to them. Now, after everything I said, you can clearly see why it's very essential to investigate potential interventions to prevent falls from occurring. One way that a nurse can do this is by implementing an exercise program of Tai Chi for the elderly population. This brought me to my research. I started my research using EBSCO and Google Scholar. My keywords were Tai Chi and fall prevention. Well, of course, this gave me thousands of articles. I had to narrow down my search. I narrowed to articles published since the year 2008. I wanted to have the most recent information, and also articles published in English. This, of course, brought down my research results by a whole lot. After much consideration, I chose 3 articles that I feel have the most relevant information to my topic. 2 of the articles are meta-analysis, and 1 is a systematic review. My first article, as you can see in the synthesis of evidence table on my poster, my first article is a meta-analysis. The primary objective of this review was to evaluate the completeness and transparency of Tai Chi trial reports published in peer-reviewed journals. The sample was 42 trials. These trials were found in Medline and PubMed, and the variables for this article was Tai Chi reporting, balance, strength, and number of falls. The instruments they used was a 10-item mini checklist. This was to assess the adequate reporting of Tai Chi interventions in the existing clinical trials. The method of data collection was a flowchart and a checklist. 3 authors independently reviewed the articles and assessed whether randomized trial reports identified in the research met the inclusion criteria. This study discovered that during the last 2 decades, Tai Chi has been extensively tested for improving balance, and preventing falls among older people. Also, 23% of the trial reports were considered to provide adequate details of Tai Chi interventions in their studies. My second article is also a meta-analysis, and it was performed to evaluate the efficacy of Tai Chi on fall rate, fear of falling, and balance in older adults. The hypothesis for this article was that besides improving balance, Tai Chi might also increase self-awareness of balance and thereby decrease the fear of falling. The sample was 9 trials. Altogether, this was 2,708 participants. They used for their search strategy a very sensitive search strategy for randomized clinical trials that was suggested according to the Cochrane Handbook. The variables were type of Tai Chi, exercise dose, intervention duration, fall rate, fear of falling, balance, and study population. The study found a significant fall reduction of 49% in favor of Tai Chi. The study also found that there was a larger effect in community settings and in higher doses of exercises. My third article is a systematic review, and this was done to provide clear evidence that falls in older people can be prevented with an appropriate designed exercise program such as Tai Chi. The sample was 54 randomized controlled trials. The variables were group-based programs, home-based programs, falls, and individual preferences. Group-based Tai Chi was found to be effective for fall prevention in several trials, but overall this systematic review confirmed that exercise such as Tai Chi as a single intervention can prevent falls. The review of all these articles is sufficient information to conclude or developed best practice guidelines which highlight features of exercise programs which are likely to be associated with greater fall prevention effects. If you look at my recommendation section on my poster, I recommend a Tai Chi program implemented for the elderly population who are at risk for falls. Of course, there would be different programs for different groups. My suggestion is 2 hours a week for a 6-month period of Tai Chi exercises. There would be a trained nurse to supervise each session, and there would be a certified Tai Chi instructor specialized in working with older adults, and he would conduct the class. And classes, of course, would be given at different times of the day and different days of the week to accommodate certain people. The conclusion to my video presentation is that there has been sufficient evidence to conclude that Tai Chi is effective in fall prevention. Nurses can help ensure patient safety by developing intervention to prevent falls in the older population. And please feel free to ask any questions in the discussion board. I would be happy to answer anything. Thank you.